Hello, my name is Dr. Craig Childress. I'm a clinical psychologist in Pasadena, California, and I specialize in treating ADHD spectrum disorders, oppositional angry behavior in children, parenting, and family relationships. And today I'm going to talk to you about recommendations for disciplining a child with ADHD. And in brief, the typical approaches to working with children with ADHD involve medication and behavior management strategies. Behavior management strategies like star charts, point systems, timeout, things like that. Now, in terms of the medication, both the medication and the behavioral management systems wind up treating the symptoms of ADHD, but not the cause. The cause of ADHD lies in the various brain systems involved, sensory motor processing, language and communication, relationship systems, motivation systems. The underlying brain systems are the cause. The symptoms are the behavioral and emotional expression. And so while medication is helpful in treating the symptoms, it doesn't really do what I would want it to do. If it was my child with ADHD, I want to get rid of it. I want to treat the causes, the underlying brain systems. The other thing about medication is there's more recent studies that suggest that it only has an effectiveness on treating symptoms for about 2 years, and that the children with and without medication had roughly the same outcome. This was a long-term follow-up to the MTA study. You can find it at the National Institute of Mental Health website, a brief synopsis of it. And so I'm not a big fan. In clinical practice, I'm not a big fan of medication. If need be to help the child out, that's fine, but I'd rather work other systems and other things. In terms of the behavior management strategies, I was trained as a behavioral psychologist. I've used behavior management strategies. They're not particularly effective. Yes, I can control the behavior of a child using them, but actually what the research suggests in working with ADHD kids is it's not particularly helpful and may actually be harmful, may actually set into place some of the ADHD processes that it's designed to manage. And so I'm not a big fan of these behavioral interventions. What I would recommend in terms of parenting a child with ADHD is first to commit your involvement. These kids need our time and involvement, more so than the typical kid. And so if we recognize that and commit our involvement, things will go a lot more smoothly. The second recommendation I would have is to maintain a positive emotional tone. What we want to work on is some of the relationship systems. And a positive tone and warmth and affection, and it builds relationships. Angry breaches relationship. Warmth and positive emotional tone. Another recommendation on this is it's important to communicate parental authority. But how much and in what way, it sort of depends on what sort of brain systems are involved. And so I would be cautious in over-relying on the authority system, the dominant submission that you have to do what I tell you to do because I can control punishments. Another recommendation I would have is to establish rhythms with these kids. That their hyperactivity and impulsivity, they're very disorganized in what they do. And what we want to do is form a relationship with them and then get some rhythms to their activity. And the basic rhythm is a turn-taking rhythm, a back and forth. And that's the fundamental rhythm of dialogue and communication. So we want to engage these kids in a dialogue, back and forth. One of the research studies talked about a pendulum swing, moving back and forth between the parent and the child and organizing the parent-child relationship. And finally, I think it's important for parents to resolve their own emotional and stress issues. That there's a connection system in the brain where we feel what another person feels. It's what allows us to feel what the actors feel in movies, where we feel their experience. Children feel what their parents feel. So if the parent is in too much stress or too anxious or too depressed or too anxious or too angry, the child imports that experience and it's too painful for them. And just like in a movie where the movie gets too scary and it's just overwhelming to us, what do? We break connection, we look away. So that happens with our kids when the parents are too angry or too depressed or too stressed. They can't tolerate that pain, so they break connection with the parents. And that's the source of a number of other problems that begin to cascade through emotions and communications and other systems. So the best thing you can do for your child is to resolve the family stresses, resolve your own personal stresses, and a happy parent can result in a happy child. Thank you so much.